Hello, I'm Dr. Shea. I've been a chiropractor for over 30 years, and I'm here to demonstrate some exercises that I've used with my patients over those last 30 years. Hi, this is Dr. Shea again. One big question that I always get from a lot of my patients is, what do I use, heat or ice? How do I know? So what I do is I ask how sharp is the pain. If it's stabbing, sharp, biting pain, it's swollen. And because it's swollen, it needs ice. And a lot of the medical profession, they say, usually an injury within the first 24 to 48 hours needs ice. But what about the patient that's constantly aggravating their problem? So you've heard it a week ago and it's still sharp and biting. What do you use? Ice. Ice, ice, ice. What I use is the flexible ice pack. So in our office we have flexible ice packs that never freeze solid. They conform right to you. You can put them right on your skin. You should never lay on an ice pack, but you can put it against you as long as it's flexible. And your body temperature will melt it fast enough that it won't burn you. But you should never lay on top of an ice pack because it could burn you, even a soft gel pack. But see how it conforms to me. So it'll conform right to your lower back. It'll conform right to your neck, just like this. Forget the frozen peas, the frozen corn. This is the 21st century. Please. We sell these for $10 at the office. You can get them at most other stores for under $15. Spend the money. They're worth it. So any sharp, acute pain, biting pain, achy pain like a toothache, ice is what you use. I suggest 20 minutes on the area, 2 hours off. You don't constantly use the ice. 20 minutes only. So my rule of thumb, 20 minutes on, 2 hours off, 20 minutes on, 2 hours off. It's a simple way to remember that. So anytime you have sharp pain, use the ice. And remember, the ice when you first put it on, oh, cold, you hate it. Don't even think about using the ice. Just do it. Put it on, and in 5 minutes, that area will be numb, and then your pain will cease. It'll make it stiff. But stiffness is a lot better than the sharp, achy pain that you have. So make sure you put that ice on and leave it on for 20 minutes, and it'll be good and numb, and it'll knock that swelling down quickly. A lot of times more than the medications that have been prescribed for my patients. Hi, this is Dr. Shea again. Now, what if you don't have sharp pain? You just have a lot of stiffness, it's mildly achy. Well, then heat is what I recommend. Just remember, when you use the heat, only 20 minutes, no more than that. No matter how good it feels, more is not better. So physiologically, heat is the best thing that you can use if you have stiffness or mild achiness. So a lot of times, we'll use a combination of both ice and heat, depending on where your injury is. Now, a low back, right at this joint, actually can be swollen, but you'll never see it. So, but it'll ache and it'll throb, just like you would if you sprained your ankle. And most people know what a sprained ankle looks like. It's very ugly, the swelling is tremendous, but in the spine, when you sprain the spine, the swelling just goes deep. So we'll have an acute patient come in with an acute low back, and we'll use ice right here, but the muscles are very tight and stiff. So we'll use heat on them. So when someone says, do I use ice or heat? A lot of times I say yes. That means ice where the sharp pain is, and heat where it's stiff and mildly sore, which is usually above and below the area of acute pain. Never use heat more than 20 minutes out of 2 hours. A lot of doctors say on and off with the heat, but I suggest heat 20 minutes, nothing for 2 hours. Heat 20 minutes, nothing for 2 hours. Same with the ice. Ice for 20 minutes, off for 2 hours. Ice for 20 minutes, off for 2 hours. Many times, a patient who has an acute low back or an acute neck can actually take a hot shower. Just don't let the water beat on the area that's in acute pain. So you don't heat that, but you heat everything else, and then you carefully get out of the shower, and then reach for the ice pack and put the ice pack on that acute area that is achy. So that's a nice way you can do it if you don't have the hot packs and the